Let's talk about 7 tips for successful breastfeeding. Number 1, you want to do skin to skin right after the baby's born for at least 1 hour. So after the baby's born, you want to put baby up on mom and dry the baby off, except don't dry the baby's hands. Did you know the baby's hands have the scent of amniotic fluid, which is similar to the scent on mom's nipples? And healthy babies are able to do what's called the breast crawl, where they crawl up by themselves and self-attach and start nursing. It's really amazing. But not drying their hands will help with that. And I will also put a link in the description to a video that shows that. If you haven't seen it, it's really cool. Number 2, that first breastfeeding should take place right after birth during that skin-to-skin time, because we know that moms that breastfeed the baby right after birth are more successful breastfeeding, even in the long term. Number 3, you want to learn to breastfeed on demand. So what that means is you're paying attention to when baby's hungry and they have what's called feeding cues. So a baby starts wiggling around, they might clasp their hands and feet, they might bring their hands to their mouth or face, they might make little sucking motions, they might root around, stick their tongue out. They might flex their whole body and turn their head side to side. That's when you want to start breastfeeding. You don't want to wait till they're full-blown crying, because then it's hard to get them calmed down, to get them to latch on and to nurse. Number 4, you want to learn about breastfeeding while you're still pregnant. So before you have the baby, take a breastfeeding class or go to a breastfeeding support group. And by the way, at Childbirth Education for the Christian Family, we have a brand new breastfeeding class. You can learn how to get started breastfeeding. You can learn about nighttime feeding, parenting at night, how to hand express milk, how to increase your milk supply, how to return to work and overcome challenges, and even how to pump your milk. So in the description, I'm going to have a discount code for 25% off our classes for a limited time, so check that out. Number 5, you really need to make sure the baby's latched on correctly. So it's kind of a misconception. People think that the baby's just going to latch on to the nipple, but they actually have to latch on back behind the nipple on the breast tissue to be able to get the milk out. So if you look in this picture, you want the baby to be across from mom with their nose at the level of mom's nipple and have the baby's chin in contact with mom's breast. Wait till they open their mouth really wide, and then mom pulls them on in one quick movement. If the baby is latched on correctly, it should not hurt when you're breastfeeding. Moms that get sore nipples and have nipple pain, it's almost always because baby's not latched on correctly. Number 6, you do want to avoid certain things in the first few weeks. You want to avoid pacifiers, bottle nipples, giving formula unless there's a medical reason, while we're getting breastfeeding established that first 3 to 4 weeks. And that's because if we go between bottle nipples and breastfeeding, for one thing, it's a different type of sucking that the baby does. On a bottle nipple, they're using their tongue to stop the flow of milk because it's coming out really fast. But with breastfeeding, what they're doing is using their tongue to actually stroke the breast to get the milk out of the breast. So it's a different way of sucking. And so some babies get confused trying to go back and forth too early. In the age of the baby, and so you want to avoid that the first few weeks. Also, any other feeding other than at the breast is going to decrease your milk supply potentially, because it's like supply and demand. So the more you breastfeed, the more milk your body makes. But if you're not breastfeeding as much, your milk supply will go down. So that's a real important piece to know as well. And also, if you are totally just exclusively breastfeeding, you're going to be more successful with breastfeeding in the long term. And then number 7, you do want to give only breast milk the whole first 6 months. And then you want to start solids or finger foods at about 6 months of age. And then according to the American Academy of Pediatrics, you want to continue breastfeeding for as long as mutually desired by mother and child for 2 years or beyond. So they've updated that recently. And you might think that sounds strange to breastfeed a toddler, but actually toddlers still have a suckling need. And also it gives them that base of nutrition with breastfeeding, because a lot of times they're finicky eaters. So check out our breastfeeding class, and thanks.